Good morning, good afternoon. Good morning, good afternoon, good evening to all colleagues joining us live today, and hello to those who are joining us after the event. Welcome to our event today entitled Joining Forces Across Civil Society Organisations and Agencies Towards Improved Vaccination Coverage. Let me introduce myself to those of you who don't know me. My name is Catherine Duggan. I'm the Chief Executive Officer of FIP, the International Pharmaceutical Federation, and I'm super delighted to be your moderator here today. Before we get going with the event, some housekeeping for us. This event is being recorded live and being streamed on YouTube. The recording will be available on our events website, the address seen here on the slide. Please feel free to ask questions via the Q&A box, and we will try to either incorporate them during our panel discussion today or address them during the event. Please provide us with feedback on this event and any follow-ups in this area you would want to see. And finally, if you aren't already, please join us as a member of FIP. So today we are delighted to have the following colleagues and collaborators with us. We have participation from the International Federation on Aging by Jane Barrett, the Active Citizenship Network, Mariano Vota, the International Diabetes Federation, Irina Vlasenko, the International Primary Care Respiratory Group, Sean Williams, and Vaccines Today, Gary Finnegan. I'll do a more detailed introduction for each of our panelists very soon. We would like to thank Sanofi Pasteur for supporting this online event with an unrestricted grant. So it's really important, colleagues. Vaccination coverage rates for several diseases are suboptimal. I think this is in all of our minds as we live with the pandemic, but they remain low, below the WHO targets in many countries of all income levels. And for FIP, it's essential to engage with civil society organisations representing different constituencies, from patient advocacy groups to older adult organisations and to vaccination advocates, to discuss and outline synergistic and complementary advocacy actions for broader access and convenience of vaccination services through a diversity of providers and pathways. This is not just a health professional issue, this is a societal issue. So today, this event brings together some of our colleagues from different civil society organisations to explore and express their concerns, their best practices and expectations, namely because we are obviously FIP with regards to the role of pharmacists for improving vaccination coverage and identifying potential alignments in advocacy strategies. Today, we're also presenting a Draft Zero of FIP commitment on leveraging pharmacists to build vaccine confidence and address vaccine hesitancy and complacency. And this document will be presented as the starting point of a dialogue and collaborative commitment to address this global imperative. Today, we also have two important other launches related to the subject that will be presented by my colleague, Gonzalo Sousa Pinto, the FIP lead for practice development and transformation. We're excited to launch the FIP new toolkit, Building Vaccine Confidence and Communicating Vaccine Value. This is a toolkit for pharmacists. And we're also launching our new microsite on our website, focusing on disease prevention, which includes a section to support the role of pharmacists in vaccination. But the aim of today's event, on top of that, includes understand the role of various civil society organisations in contributing to increased vaccination coverage, to explore drivers and barriers to diversifying vaccine pathways and providers, and to allow for better access to vaccination services, to discuss possible actions and synergies by the different stakeholders in addressing vaccine hesitancy and complacency. So without further ado, it's my great pleasure to introduce the panel one by one for you to get to know them and the organisations they represent. So first and foremost, my colleague Jane Barrett, Secretary General for the International Federation on Aging. The IFA is fondly abbreviated to the IFA, is an international non-governmental organisation whose members are governments, NGOs, academia, industry and individuals in nearly 80 countries. The IFA believes that all these members working together are essential to help shape and influence policy and good practices. The IFA stands to drive the agenda for the world's population's ageing. And we're proud to have a general consultative status. They are proud to have a general consultative status at the UN. The IFA is a non-state actor in official relations with the WHO. So we stand shoulder to shoulder with you. A little bit about Jane. Jane is the Secretary General. And as I've mentioned, they have formal relations with WHO and a standing with the UN, representing over 75 million older people through the membership of the IFA. Jane has direct responsibility for the corporation's operational performance, the quality and strategic implementation and business development. And that includes leadership at the UN Economic and Social Council in New York, Geneva and Vienna, and the WHO. Jane herself is a Winston Churchill Fellow and recipient of the Queen Elizabeth II Diamond Jubilee Medal in Canada in recognition of her commitment and passion to enhance the understanding of issues relating to ageing and engaging in a dialogue with governments and the private sector to improve the quality of life of older people. Jane, welcome to our panel today.
Thank you very much, Catherine.
Lovely to have you. Next is Mariano Votta, the Director of Active Citizenship Network. The ACN was initiated in December 2001 as the European and international interface of the Italian civic participation. ACN is a flexible network of European civic organisations involved as partners in its different projects, addressed to encourage active participation of citizens in European policymaking. The ACN mirrors the Italian policies such as health, corporate social responsibility, education and training at the global level. The mission is to promote and support the construction of the European citizenship as an active citizenship, which means the exercise of citizens' powers and responsibilities in policymaking. Super important. ACN recognises the prior role of national and local civic organisations in this process and advocates enrichment of the EU subsidiary concept by strengthening the relationship between institutions and citizens. And this is a really important initiative and one that we welcome ACN's support with. Mariano is a public affairs professional and journalist and is the director of ACN, where he is responsible for European affairs. Passionate about healthcare and consumer issues, Mariano has more than 20 years of experience in the field of advocacy, stakeholder engagement, EU projects, communication and civic information. Since 2013, he has been actively involved as ACN stepped up its advocacy activities at European institutions, which in 2015 led to the official launch of the MEP interest group, European Patients' Rights and Cross-Border Healthcare, promoted with endorsement of almost 100 organisations across Europe. Welcome, Mariano. We look forward to your contributions today.
Thank you very much, Catherine. Greetings from Rome, Italy.
Thanks a million. Third, we have Irina Vlasenko, who is the Vice President of the International Diabetes Federation. The IDF is an umbrella organisation of over 240 national diabetes associations in 168 countries and territories. It represents the interests of a growing number of people with diabetes and those at risk. The Federation has been leading the global diabetes community since 1950. IDF's mission is to promote diabetes care, prevention, and a cure worldwide. IDF is engaged in action to tackle diabetes from the local to the global level, from programs at the community level to worldwide awareness and advocacy initiatives. The Federation's activities themselves aim to influence policy, increase public awareness, and encourage health improvement, promote exchange of high quality information about diabetes, and provide education for people with diabetes and their health providers. IDF is associated with the Department of Public Information of the UN and, again, in official relations with the WHO. Irina herself is an international expert in diabetes. She's taken part in the development of regulatory documents, medical standards on a national and international level. She's participated in many meetings with governments and other key stakeholders and attended many international congresses. She is a member of the European Medicines Agency, working party with patients and consumers, a member of the PCWP EMA, steering group of the European Network Centres for Pharmacoepidemiology and Pharmacovigilance, and is responsible scientific editor of a pharmaceutical journal, Ukraine. Welcome, Irina.
Thank you so much. I'm happy to be to this.
We're delighted to have you. Thanks a million. Next on our list is Sian Williams, the CEO of the International Primary Care Respiratory Group. The IPCRG is a clinically led charitable company that works locally in primary care and collaborates globally to improve respiratory health. Their vision is that through universal access to the right care, everyone can breathe and feel well. The IPCRG is an alliance of 37 national primary care respiratory organisations, reaching over 150,000 GPs and other primary care professionals around the world. They're a community of practice, collaborating globally and on respiratory research and innovation, and exchanging knowledge about best practice and impact. And Sian herself is the Joint Chief Executive Officer at the IPCRG. Public health trained, she is particularly interested in large-scale change and the creation of a sustainable global respiratory network for improvement across low, middle and high-income countries in the context of their commitments to the SDGs. Beginning her career in the UK NHS, Sian has extensive experience working in respiratory care, including IMPRESS with the British Thoracic Society and Primary Care Respiratory Society in the UK, co-leading the London Respiratory Network and also helping Smokers Quit in London. Sian developed the argument for the value of flu vaccination for both healthcare professionals and people with chronic respiratory disease through her work in the National Health Service in London, which has now been taken up across the countries in the UK. She is working with the IPCRG to make the case globally for the high value of flu vaccination for people with asthma and COPD and healthcare professionals, and also pneumococcal vaccination for people with COPD. You're welcome, Sian, to our panel today.
Thanks, Catherine.
Lovely to have you. And last but by no means least, we have Gary Finnegan, the editor of Vaccines Today, which is an online platform for discussing vaccines and vaccination. The target audience is the general public and others in Europe with an interest in immunisation, which of course has been peaked in the past 20 months. The platform strives to provide an interactive forum for informed debate on issues around vaccination, as well as to serve as a source of reliable information, bringing the community of stakeholders together to share their views. And Gary is the editor of Vaccines Today. He has a degree in physiology and an MSc in science communication. He has been a national winner in Ireland of the EU Health Prize for Journalism on 3 occasions and has won 2 Irish Medical Media Awards. Gary plans and prepares content for Vaccines Today with the support of an editorial board. Welcome, Gary, to our panel today.
Thanks, Kevin.
Lovely to have you. So without further ado, what we'd like to do is to really just showcase all of our panelists today, put the slides away, and to run some questions around the panel. We're also keeping our eyes on the Q&A box there, and we'll be seeing if there are questions that either can be answered by the questions we already have prepared, or whether new questions emerge that the panel might wish to answer themselves. So without further ado, I'm going to start with Jane with my first question and move to Sian, Mariano, to Sian and Irina. Although the new WHO immunisation agenda for 2030 advocates a life course approach to vaccination, Jane, we know that in many countries, vaccination strategies are largely centred in childhood and adolescence, and also often vaccination targets are lower for those older adults than they are for children. Now, as the General Secretary for IFA, what's your view on this, and how can we expand vaccination across the life courses and ensure equity of access at all ages?
Thank you very much, Catherine, and it's a real pleasure to be with you and your colleagues around the world today. This is actually a very complicated question, so let me just back up a bit and say, you know, you're quite correct. There is something named in the Immunisation Agenda 2030 that says a life course approach to vaccination. Equally, in the UN Decade of Healthy Ageing, we talk about a life course approach to ageing. However, neither of the documents actually explain how to actually execute or implement a life course approach to ageing or vaccination. But it does reflect a life course, so from birth to death. And one would suggest that across the life course, at different stages in life, you know, vaccine preventable diseases can be counteracted with vaccines, and that's the case. And yet we also know that the National Immunisation Technical Groups, which are the authority that recommends vaccines to government, don't have a life course approach to vaccination in their representation. So when I talk about older people, you know, 1 in 17 NITAGs have very few, back the other way, 1 in 17 NITAGs, you know, have any representation reflecting older adults. So while that's not a bad or a good thing, we need to acknowledge to the government that this is a real issue, because it does then reflect, I think, about the targeting. Now, the targeting we know is, you know, there is disparity. So for influenza in Europe, it's 90% for WHO for influenza, but it's 75% for adults. So one starts understanding that it's a layering effect. You know, the IFA would advocate for the implementation of a life course approach to ageing and vaccination, and in doing so, trying to really get to the heart of the issues of inequity. And just before I finish, one is ageism, as we've seen very clearly across the pandemic. 2, pre-pandemic and throughout the pandemic, lack of targeted messages, you know, to particular groups. And I'm delighted that IDF is with us today, you know, because that's one of the targeted groups, the high-risk groups. Also, there is a limited understanding in the public health messaging and also just the recommendations to outreach the social determinants of health that underpin many of the equity issues that we deal with on a day-to-day basis. So much to talk about, Catherine, so I'll hand it back to the floor, otherwise I'll take up your whole session.
Well, that's wonderful, Jane, and that's why we have you here today. Mariano, what is your view on this, and how can we expand vaccination across the life course, ensuring equity of access at all ages? Jane's posed some real challenges to us there. What would be your response?
Yes, as said by Jane, it's a complicated issues that several factors are to be taken in consideration. We can probably try together to overcome a paradox. Something that should affect the most of us, that is the prevention, is still at the end of the health expenditure in my country, but also across Europe. This is my context in which I work. We can change the government, we can change the leader of the European institutions, but the health expenditure in prevention is still at the end of the ranking. So this is extremely the first point that we have to be in an extremely clear way to denounce. Probably also the way in which the European institutions talk about the member state to take under control the debt or the inflation is fine, but we need to talk more about the crucial role of the prevention. In this context, in the prevention issues, we have to increase the resources for immunization. Also to be more flexible, because one and another 1 year from another one can change the need. So this is important. After that, some innovation, because at least in my context, it's more easy to book a reservation, a flight to go far 800 kilometers than to book a reservation for a vaccination center. This is not acceptable at all. Last 2 points are one linked with the lack of cultural acknowledge. So it's crucial, and I want to thank the International Pharmaceutical Federation for the involvement of the civil society organization, because there is a lack of knowledge according the concept and the implementation of life course immunization approach, cultural change that we need. Last but not least, we have to agree about the relevance and the involvement of all the healthcare categories, professional categories, in the immunizations policy. So there are several elements, and all of them are relevant according to me.
Thank you so much, Mariano. I think there's something here that we can do collectively, and then obviously each of us have a different focus, but your points are well made, that this is a cultural issue. So one organisation can't do this on its own. That's really, really important. And I know we all have our different lenses, whether that be aging populations or that be respiratory or diabetes. But Sian, coming to you, what's your view on this expansion concept and the equity of access piece as well? Sian.
Thank you, Catherine. Well, I think I agree with everything that's been said. I think in addition, there remains insufficient focus on non-communicable disease. So if you look at the WHO's department and size, we've got a new medical officer for respiratory for the first time in 15 years, it's just now. So firstly, we need to understand about the impact of non-communicable disease on the world and the cost to the health service and to society as a whole. And then we need to look at the interventions that are high value interventions for those non-communicable diseases. And we've known about the value for immunisation for flu vaccination and pneumococcal vaccination and respiratory disease since the 90s. If you look at the CDC's guidance for COPD, it uses a study from the 90s on the value of reducing outpatients, reducing hospitalisation, reducing death. So the evidence has been strong for a long time, but it's just there isn't yet this commitment to a focus on NCDs and then thinking through this lens of value. And I don't know, can I share my screen? Because I just want to show a value pyramid that's been developed, and it might be quite interesting to do something more on that, if it's possible to share it.
I'm sure we can enable that, Sian. It might take a minute or so. There you go. There we go.
So look, this is a value pyramid we did, which went on the cover of Thorax, which is one of the main respiratory journals. We started this work in 2010 in the UK, where we tried to compare the cost per quality adjusted life year for the different interventions for people with COPD. We called it the COPD value pyramid. And you can see there that flu vaccination is the foundation for everything. And then stop smoking. And I think that's quite interesting in terms of the potential pharmacist role, because, hey, look, they can do both of those things. So I do think that we need to see things through the lens of value. And we know that the rates for vaccinating people with COPD for flu vaccination are incredibly low at the moment.
That's super important. And I think, from an FIP perspective, we're seeking to demonstrate the value of pharmacist interventions in all of these issues. I would say that when we start to silo off NCDs away from the prevention agenda, you really miss some of the synergies you can achieve there. And for FIP, just to bring my panel up to speed, we've got 3 big bundles of activity that we want to demonstrate pharmacist value in. NCDs, the prevention agenda, which includes immunisation, self-care and safety. And if we can see the synergies across all of them, Sian, I think we won't miss a trick when we understand patients with existing comorbidities. Jane, they do tend to be older, can suffer worse during pandemics, for example, or during infections. So it's a no-brainer, so to speak. Yeah. Speaking of NCDs then, I wonder if I could go to Irina. Irina, what's your view on how we can expand vaccination across the life course and ensure equity of access? Particularly important, noting how I know COVID has been described at the very start as a respiratory disease, but actually look at the impact it's had on patients with comorbidities like diabetes. Irina.
Thank you. I first of all, I agree with my colleagues who said underlies some special problem with culture and it's our patients. But in same times, we have not enough access to vaccine. This one point. And second, I think we must improve our awareness about vaccination and work with not only with patient and with family, because this is with relatives of elderly people. This is very, very important. And in this case, it's big value of what do pharmacists, because mostly people with diabetes very often go to pharmacy and can got from them information about vaccination, how it's important for especially for people with diabetes, because it's big risk in people with diabetes in risk groups, and this is it must be work. But in same times we must prepare, we must train in pharmacists about this, because it's new knowledge. And I'm not sure that every pharmacist get ready for this consultation. It's our big part of our work also. Thank you.
Another reason, Irina, why we can't do things on our own. We need to share and learn from each other and to really join forces in tackling such an issue. Thank you, colleagues, so far. I'm going to move on to my next question, and I'm going to start with Mariano and then Jane. There are important ethical issues in the enormous differences of access to vaccination that exist across countries. We've seen this markedly. I mean, we're really in almost like a two-tier system with the COVID vaccination, for an example, but also within each country. For many patients from specific socio-economical groups or locations, how can access be improved? And Mariano, I start with you, and I know you've got a couple of studies that you wanted to reflect, which would be really useful to do so just now.
Yes, I don't forget what was the first reaction of the member state, at least in my context in Europe, during the first wave of the pandemic. It was a very high, we can say, nationalism, in which member states decided to close not only the frontiers, but also to stop the exports. So we have to increase much more the spirit of solidarity. This among countries. This is the first, the first message, and luckily the European Commission take a strong commitment. But at the first wave of the pandemic, immediately it was the first reaction. It was to not take in consideration the need of other contexts within the country. Within the country, there are a lot of discrepancy in access to care, not only for the immunization, but is still pending issues for all the aspects. And we have also to be extremely clear. And during the pandemic, it was clear, at least in my context, where the vaccination centers were closed, with the message, please come back, but we don't know when. During the same period, pharmacists were at least almost open. Some of them with closed doors, like they work during the night, we can say. But this is crucial, because the message was that even in the context when the door of the national health system, represented by the hospital, in which it was impossible to come for not COVID-19 issues, for the general practitioner and for the vaccination center, it was impossible to come, the door, the windows represented by the pharmacists were open. This is something that extremely relevant act that we have to take in consideration. We have produced a survey about it that was also published in an international peer-reviewed journal that testify what happened. So this is important to consider different solutions for this new challenging situation. And one of these is, of course, linked with the involvement of the categories of healthcare professionals more close to the citizens. Another point is linked with, according to me, talking in general, what is the level of awareness about the global health? Are you perfectly aware that each one of us have to play a role in the context of the health as a common good? So again, the awareness, the citizens' engagement, the commitment of the intermediate bodies from my side is crucial to try to reduce the gap in access to care. Is true for the vaccination, but it's true, to be honest, also for other healthcare issues.
Thank you so much, Mariano. No, you're right. It's a phenomenon that we've seen globally, that pharmacy remained open with the lights on, maybe dimmed at certain points, but remained open throughout this pandemic. and there's lots for us to learn and take from that. Jane, how would you say access can be improved?
Look, Catherine, I just want to go back to this word of ethics and think about it from a global perspective at the moment and in the midst of COVID. You know, it's probably not well known, but there are 3 countries in the world that haven't even started vaccinating people. And so, you know, there is such an extraordinary imbalance around the world. You know, while some countries are talking about the 3rd, you know, the booster, we have some countries that haven't even started, and also many low and middle income countries have less than 10% of their population, right? So when we talk about global solidarity, you know, we really need to step back and own that people are being left behind. And this phrase of leave no one behind, well, guess what? You know, they are not only being left behind, but they're being left to die. So ethical issues, you know, are local and they're global. And we need to own both of them. We can't just say, no, I'm just going to just focus on, you know, we need to be part of the global conversation and the regional conversation. I just also want to touch on, you know, the growing theme in some countries about mandatory vaccination. And I am absolutely unequivocally, you know, pro-vaccine. There is no question. However, there are some people in our community, and it's pre-COVID as well, that are unable to receive vaccinations for some reason. And yet we are actually building a society of non-vax, which is quote unquote anti-vax, and that's not always the case, and those that are vaccinated. And so there's a real judgment coming in some of our communities. And I think that's part of our ethical dilemma now. And we as professionals, how do we communicate that? I think also consent, and I think of predominantly the population that I represent, and that's older people, you know, and informed consent versus being vaccinated because they have a decision-making disability. And that has another layer of caregiving around it. I think access issues, Mariano has really given some fine examples, but let me give you one more. And that's in the country that I live in, Canada. We had something called pop-up clinics. Sounds great. However, as soon as the pop-up clinic happened, the pop-up clinic closed. So, you know, where was the pop-up clinic happening? For whom was it happening? How were older people going to get there? And we had lineups of 6 hours. Now, while we're talking about COVID, we can also take some of these examples, and I'm of the firm belief that we need to actually take the vaccines to the people in some situations rather than ask older people to go and line up for vaccines. Or another case is they're eligible for an enhanced vaccine, but they need to shop around to different pharmacies to find out where it is. And so, you know, communication is going to be key in this. So I'll leave it at that, but a number of different layers when we come to ethical issues, Catherine.
It's really interesting, Jane. So we see globally that there are the haves and the have-nots in terms of access. We also see locally the haves and the have-nots because, you know, perhaps vaccines are available to those who have the flexibility in their work life to go and access them, and perhaps those that can't. We see the come to the vaccines which may not be accessible for many, and we also see the fact that a lot of that communication, I see this with my own parents, that communication is being done digitally and they're not completely comfortable, or perhaps you have an elderly parent with dementia, for example, who can't access the information digitally. So access has so many different layers, and as you say, there's an ethical thread through all of this that we all need to pick up and run with. Thanks so much, Mariano and Jane. I'm going to move us to the next question. We've got so many to get through. I do apologise for this fast approach. We probably need 4 or 5 hours on this. And it's to Gary. Gary, pharmacy-based vaccination exists in some 40 plus countries. And we've just heard from Mariano the fact that this has been very good for all socioeconomic classes. But what would you tell countries that don't have it yet? What would be your message from Vaccines Today?
Thanks, Catherine. Well, I got my own flu vaccine 2 weeks ago in my local pharmacy, of course. And I wondered to myself, would I have gotten it so easily if it wasn't possible just to pop into the pharmacy? And maybe not. I'm not in a risk group at the moment. If the vaccines were in low supply like last year, I probably wouldn't have got it. But as it happens, it was very easy to do. And I think that as that sort of anecdote illustrates the wider point that pharmacy-based vaccination adds new people into the vaccinated list that might have been missed otherwise. And I think the reason that maybe it hasn't happened in so many countries, most countries, as you said, don't have pharmacy-based vaccination. And one of the reasons, I think, is that people are just not in the habit, and they can get in the habit very quickly once it begins. But also maybe policymakers and even other health professionals thought they would just be moving vaccination from one place in the system to another. So moving it from the GPs probably to pharmacists. But I'm in Ireland, and the data from the Irish Pharmacy Union suggests that they are adding people who had never been vaccinated before for flu. So I think, the one thing to say is that you will get additional people. It's not just moving them around. And then the other reason, I suppose, when we talk about vaccine hesitancy, there are 3 C's of confidence, complacency, and convenience. And I think vaccine confidence, if your pharmacist themselves is vaccinated and is a vaccine champion, that they are very well placed because we trust our pharmacists. In terms of complacency, the main problem with complacency, apart from COVID, is that people don't perceive a risk of, say, pneumococcal disease, or they don't know it's preventable. So again, pharmacists can play a role when they see someone, especially in at-risk groups, and say, do you know this is something I can help you with? And then finally, on the convenience issue, to go back to the start, I'm in a relatively small town outside of the main city, and I think we have 6 pharmacies. It's all pharmacists and hairdressers in my town. So sort of one-to-one services. So these are things I can walk into. I can have a conversation if I have a question or I am hesitant. I can talk to my pharmacist. I probably won't get that type of time from my GP, realistically. So I think, pharmacists, also practice nurses and others who might have a bit more time to have a discussion, if they are confident themselves, they can play a really important role in increasing overall uptake.
Thanks so much, Gary. What I take from that are your 3 C's, and the fact that actually pharmacists provide essential services, as do hairdressers. We all knew about that in the lockdown, didn't we? But I really like that. I like the idea. We also know that evidence really clearly at FIP that pharmacists don't take vaccination business from others. There's enough business out there for us all. And actually, when you think about the NCD burden, which is my next question, the NCD burden provides us in an aging society with enough business for us all to be kept super busy. Thanks, Gary. I'll be back to you in a short while. I'll move us along then to really build on Irina and Sian, your previous discussions around the NCDs and vaccination. We know that patients suffering with chronic conditions often present comorbidities. This is often the overlap between diseases is often not discussed because we think of patients with diabetes separate from patients with cancer, from patients with mental health, from patients with, and then overlay the non-official NCDs, dementia, Parkinson's, all of the other diseases on top. We know that those patients may be at a higher risk of complication from infectious diseases. And, I mentioned earlier that IBID was described as a respiratory disease. It's now got much more of a syndromic set of symptoms. But from a diabetes or a chronic respiratory disease perspective, does it make sense to leverage pharmacists to provide vaccination and disease management services? I think the answer might be yes, so it'll be more like how. And I'm going to go to Irina first.
Thank you so much for this question. It's really important to our risk group, old age, and the presence of comorbidities, including diabetes associated with more severe scores and high fatality rate, of course. And we know this, and this is big challenge for our patient. And the International Diabetes Federation cites the two main reasons for patients with diabetes being high risk for COVID infection, namely the functional immunocompromised state association with diabetes and the favorable condition hyperglycemia. And this condition, and we IDF make big input for explain how to manage diabetes during this COVID pandemic. But from my side, as say Mario, and I also know that many people, not only with diabetes, every people have not access to medical care, and this during long period they have not medical care support. This is big problem, and only pharmacists can be available. And as I say before, that patient with diabetes very often go to pharmacy, and this case is maybe it's a good combination for increased vaccination. And also it's big role of pharmacists for explain this big problem, and then you must got vaccine. This is also very, very important work with individual because they trust to pharmacists. And from my side, it's could be good idea, but in same times it's you know, this it's not everywhere pharmacy involved in vaccination, but it's our goals from good pharmaceutical practice. We must be involved in vaccination. It's our law, but by which way we can increase awareness about this problem and also do this. But I make a small interview my colleagues in Ukraine, and opinion divide. And this case, many of them get ready for innovation, for new methods, for new services that open. Pharmacy is open for this, but in same time they're afraid responsibility of this because they not prepare, they not training for what happens during this medical procedure. We have not graduate this tema in graduate education pharmacists, and this a lot of problem. But my think it's good idea, but must be good prepare, because from my side it's not last in pandemic, and we must be ready for next if it cannot make now.
I know, Irina, that fills us all with icy hearts, doesn't it, to think that this won't be the last one, and we're not even out of this one yet. But most of the problems you mention are surmountable, and I think it's for us as a profession to then enable support and ensure pharmacists have the training, so there aren't those excuses not to engage, if that makes sense. And I think the advisory role is really super important. Sian, I'm going to move to you. You know, how do you think we can leverage pharmacists to provide vaccination and disease management services, or where do you see these needs sufficiently covered?
Thanks, Catherine. I mean, I think there's always scope to ensure right care is delivered in the right way. And if you take something like breathlessness, which is a cross-cutting theme of, you know, it's a very common morbidity, then you know, you really need things to be local for people because they're going to struggle to get further afield. And you know, if you take China, for example, there are 45 million people with asthma and 99 million with COPD. So these are really, really common problems. But I think we do have to have policies to make it easy to do the right thing. And that's this challenge of balancing sort of reimbursement for services as opposed to sales. So I think we have to acknowledge that at the moment, not sometimes the wrong thing or the not as good as it could be thing, it gets done in pharmacies. So, you know, there's probably unhelpful cough medicine sold. We know, particularly with asthma, that the short-acting beta agonist is overly available. So there are some needs to sort out the policy for reimbursement. It's not that the pharmacists we speak to have a great desire to provide services, but they still have to earn a living. And then there's obviously education as an incentive as well. And then I think we could be sort of even more innovative, if you like. So, you know, certainly if you go in the UK to a supermarket on something like Shrove Tuesday, you'll see you won't have the lemons in the vegetable and fruit section and the flour in the baking section. You'll have a bundle of things near the till to encourage people to think about making pancakes. And so if you think about what pharmacists could offer, well, there is the education, but then there's also, coming back to, you know, breathlessness, then there may well be smoking cessation that can be offered, the nicotine replacement therapy, but also the very brief advice, counselling, and the reminder about vaccination, and also helping people to navigate to local services, because physical activity is hugely important in all these comorbidities. And so again, can a pharmacist be rooted in their neighbourhood? Can they help navigate towards support groups and so on? So it's about recognising that not everything that's done at the moment is right care. There are plenty of opportunities if we can get the opportunities and the motivation right.
Really love that, Sian. Thank you so much. We'll be scribbling down your ideas, getting people in centrally into the community, and these care bundles, which can include a bit of self-care, but also management of a condition, some preventative strategies as well. It's really good. Irina, I saw that you had your hand up.
Well, only one comments that my Ukrainian pharmacists also speak about limitation. They positive spoke about vaccination in pharmacy, but now it's not prepared because not the training and so on. But anyway, they can provide a place for vaccination in pharmacy, but provides this medical procedure must by doctor or nurse. Thank you.
Excellent. So that's a good way of getting pharmacists or pharmacy involved in countries or regions or areas that don't have the legislation enabled, but they could be an access point. Very good. So now I'm going to move to flu vaccination, and I'm going to go back to Sian and then Gary. Sian, the low rates of flu in the previous season due to measures such as face masks and social distancing, i.e. those measures work to reduce all virus spread, might present a problem in the Northern Hemisphere in the coming flu seasons, as immunity in the community might be compromised. We know this, and I think it's a big issue for our health services in the Northern Hemisphere at the moment. But how do you think a collective effort can be made to ensure sufficient vaccination coverage against flu in the near future?
Thanks, Catherine. Yes, I mean, I think that well, all of it comes with sort of consistent messaging, doesn't it? And also trust and record keeping across the system. So certainly as we try and increase the number of possibilities of where you can get a vaccine from, so there's a risk that people are getting notified by a different part of the system and getting terribly confused. So, and this comes back to a very basic point about, I've heard a number of times people talk about, you know, GPs haven't been accessible and pharmacists have been available, and that's really good, but let's don't knock GPs, because there's also a risk that they're feeling hugely pressurized at the moment. People in the UK, GPs in the UK are retiring and leaving the profession because they just feel that sometimes, because they aren't a shop front in quite the same way, they feel that they aren't a hospital, they're getting forgotten about. So let's just make sure that it's a real asset-based approach and that we recognise all the parts of the system. I think we do have to have very consistent messaging. So there's a flu fighters campaign that the UK runs, which has been really good. Lots of materials, fun materials, which go out through all the main channels to all parts of the system, all giving the same message. So I think that's really important, as well as recognising that even if the flu vaccination isn't perfect, it will stop hospital admissions, mortality, and all the other things that people are worried about with COVID. But we've got to make sure that people realise that there's another infection out there which can have very similar effects. So we've just got to come back to my first point about value. People have got to value flu vaccination. They've got to understand why it's important. And again, we must have healthcare professionals having vaccination. We did some work in the UK showing that even the sickness absence rate of healthcare professionals is affected by flu vaccination of healthcare workers. So everybody's under strain at the moment. We've got to keep our healthcare professionals safe. Therefore, we've got to make sure that they're vaccinated, and then they become really positive role models. And that is, I mean, it's quite staggering, the statistics on that, really. So I think it's all those parts of the system being consistent and valuing the service.
I think the value word is very well placed, Sian, and I couldn't agree with you more. And I think you all need to know that FIP advocates for pharmacists being part of that vaccination success story very importantly. Before I move to Mariano, I noticed, Jane, you have your hand up. I'm not sure if it's for this issue or the one before. Apologies for not spotting it earlier.
Oh no, look, it's such a rich conversation. I just wanted to put a different perspective forward, and while not wanting to be disruptive, I think it's really important that we talk about pharmacists possibly be doing and this and then this and then this and then this. I think, what do you do and what do you don't do? And I'm not a pharmacist, but what I'm hearing also is that their bandwidth has just about broken, and they are being asked to do more and more with the flu season coming forward. And remember, it's not only flu, it's pneumococcal, it's shingles, it's Tdap. So let's sort of think beyond the flu, right? And so I would like to hear from FIP, what is your core business? What's your additional business? And what's the other? Because, if you've got a finite working week, whether it's 40 hours or 60 hours, is one of your priorities to ensure that you best help inform a person's decision making? Because that's what we're saying. What information do I need to convey in whatever way so that a person can make a decision to be vaccinated or not? So I'm just curious, because there's a lot of tension, and I know the frontline workers are exhausted, but I get a sense that we are all exhausted. And so it's about, there is a community that needs to come together and understand what we do and what we don't do. So I just feel that there's a lot of tension, and we're not only talking about high income countries here. So I just put that out there just for observation and thoughtfulness.
I think, Jane, that's a really good point, and perhaps something we could take on in more detail. But for us, at a global level, I think we would wish for the profession to have a menu to choose from based on the needs of their communities directly, and also to have sufficient workforce, not just more pharmacists doing more stuff, but more support staff in the pharmacy who can take on the different roles as well. So I think, Jane, you have to practice what you preach as well. And we all now need to look at what is our essential job versus what's our desirable job versus what's our additional add-on extras, because you're right, you cannot keep on doing more and more and more to the good quality that's needed. So we'll take that offline and make sure that FIP comes up with the menu of services, and that also is influenced by the regulations or the legislations in different countries as well. So we don't want to be advocating for roles that are just not possible for pharmacists to engage with, because that alienates people as well. One point on Sian's comments that I think really fits with Jane's previous intervention, before I go to you, Gary, and that is, we can't pit people against each other, the vaccinated against the non-vaccinated, or the vaccine hesitant, or the GPs against the pharmacists or the nurses. It's this divisive nature of communications in our communities that is causing part of the problem, I think. So I really take that point, Sian. This isn't us against them in any shape or form. It's us with us. And that needs to be a message that might seem motherhood and apple pie, but it does need saying, because we see a lot of this happening. And actually, that takes me neatly to asking Gary the same question. How do you think a collective effort can be made to ensure sufficient vaccination coverage? And I'm saying flu, but Jane's right, you know, flu and other programs as well. We really need to get the whole notion of vaccination out there a bit more. How can we do that in the near future?
Well, I like some of the things that have been said already about integrating or, you know, bundling up services, and even beyond medical and pharmacy sales, you know, integrating flu vaccine and other things into other, you know, sporting or into trade unions or, you know, active retirement groups or patient organization events. You know, I think when people retire, for example, they should probably get a bundle of stuff. Like in Ireland, you get a free travel pass. Everyone's very excited about getting the bus for nothing. You get line rental is cheaper on your phone and stuff, and you're also entitled. This is already true. You are entitled to a flu vaccine, but maybe it's a way to package it and say, here are some of the benefits of the next chapter of your life. So you know, I think, taking it even out of healthcare settings, obviously delivered by health professionals ultimately, but I think that might be useful. And then just on the pharmacist thing, probably is worth saying that not every pharmacy is well equipped to deliver it. I talk to pharmacists and most of them are quite keen to do it, but sometimes they say, I'll do flu, but I'm not keen on COVID, or I don't know about pneumococcal, because you have to have people coming in, waiting for 15 minutes, for COVID at least, exiting by a different door is ideal. So, you know, not everyone wants to do it. So the menu, as you said, is very useful. And then finally, training for pharmacists obviously is essential if they're delivering the vaccines. But I think training and communication is important. If they're going to be faced with questions, again, back to flu, you know, I read this doesn't work so well for people my age. You know, that's a tricky one if you haven't thought about that one before. And it has to be handled carefully. If a pharmacist hasn't got a ready answer for that, and as you said, there are several people have said they're juggling a lot of different topics, and if they look a little bit unsure when a difficult question comes, this undermines confidence. So training for anyone, including communication training.
That's a really good point, Gary. We hear a lot in pharmacy about what the new graduates might come out with, and at any one point in time you've got more than 85% of your profession in the workforce, and everybody needs little refreshers. And actually, Gary, what we noticed was the profession really valued an update from us, but also their own national organisations at the start of COVID. Let's just take ourselves back to this time last year, when literally day by day evidence and information was changing, and also people couldn't even see their relatives. They would come into the pharmacy just to have a chat about, what about this new drug that's coming out, or what about a vaccine that's on the horizon, you know, what can you tell me? So I think equipping pharmacists to feel more certain with the information they can impart, and also, Gary, to be honest and say, you know, the evidence isn't clear yet, but what we're seeing is blah, 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 to make it very clear that the uncertainty doesn't lie with them, but with the evidence base of certainty, if that makes sense. So really noting that. Now, colleagues, I'm going to round us off with our last question for the moment. There might be a final opportunity near the end of the session. I'm going to go round my panelists with a question that I think is so important for today's event and for each of us. And it's around vaccine hesitancy. And I'm actually going to start with you, Gary. Then I'm going to go round my panel one by one. But vaccine hesitancy and concerns are considered by WHO as a major threat to global health. I'd say in the pandemic, it's one of the major threats to global health. And may I say, misinformation is the top one. The amount of anti-vax information, conspiracy theories, fake news circulating on the internet is, for all of us, simply alarming. And what dangers do you see vaccine misinformation represents from your point of view at Vaccine Today, and how can we tackle this threat together? Gary?
I suppose sometimes I think back to the very Vaccines Today was launched 10 years ago after the last pandemic, although that one didn't feel like a pandemic in the way that this one does. But at the time, one of the complaints was that there weren't enough pro-vaccine voices on social media. And so the vacuum was filled by anti-vaccine voices. This time it is much, much better. So you've got health professionals on there and institutions are more willing to speak out. And I think once people see that there is sort of a unified message and a diverse coalition, and a quick example, back another Irish example, if you'll allow me, we had a real crisis with HPV vaccine uptake, and a coalition was put together of about 40 organizations, doctors, dentists, teachers, the Women's Council, students groups, the Cancer Society, and so on. And there was something for everyone. You know, everyone could see an organization that they trusted. I don't even think the NHS equivalent here, I don't even know if they led this campaign. It was more of an NGO and you know, scientific society group. So the point being that you know, a diverse coalition of voices that sings from the same hymn sheet really helps to breed public confidence.
So Barry, hold that thought, because we have a diverse coalition on this call, and I know we have a focus on pharmacy, but goodness me, can't we use the diversity of this coalition to best effect? And with that, I'm going to move to Mariano. Mariano, how can we tackle this threat together?
We can probably start to the title of this meeting, because the key is to try to join forces, but in a very long-term strategy, not just a spot initiative. This is crucial, and this is affect the corporate social responsibility of each actor, public and private sector included. 2 days ago, the president of the Republic in my country said that more or less the infection is now under control in Italy, mainly thanks to the vaccine and the civil sense of the large part of the population. So this is crucial to also identify who are the allies, who are the ones who can strengthen alliance. The intermediate body of the society are crucial also to endorse some message, to identify and to help citizens to identify the official source of information. It is impossible, according to me, that 100% of the citizens decide to vaccinate, because there is in each society a percentage of citizens that renounce to follow not the vaccine, more in general to follow the institution. So we have to live together with, but our power is, like the president of the Republic said, the civil sense of the society, together with the effort of the scientific approach, that is the vaccine, the innovation, etc. And this is crucial, also including the role of the media. When we talk about the misinformation, if we provide too much evidence to a very limited group of citizens that in a legitimate way they are in opposite to the vaccine, etc., we have to identify also the social responsibility for all the actors, including the media, and I can say in general the public and private sectors as a whole.
I really think that you've raised a point here that I want to reflect on, Mariano, very, very briefly, and that is the fact that the media is part of society as well. It's not a reporter of society, it's part of society and can influence opinion. And the way in which they portray sometimes an opinion as a fact in a newspaper or on a show, and a fact as an opinion, as though they are interposable, you know, opposites and of equal value, is a real problem for us at the moment. And we see that with climate change as well. So Marianne, you make that really good. All of your points have been excellent, but that's a really good new one. I'm going to move to Irina now. How can we tackle this threat together?
I agree with my colleagues. We must find we must involve in this campaign, not only healthcare professional, and also another people who can influence on people. I can say about one example. For example, in Norway, have big society like don't want to vaccinate, but they invite some people like religion chief, and is in Norwegian, he can explain that it's need to them, and this is also a big influence on society. And I also can tell about one example from our diabetes background. We understand that our media don't know about diabetes, and one of our training, we make special training for journalists, how to explain some things which really fact about diabetes, and this is help to them make information like facts information. Yes, work on.
Great advice, I think, Irina. Yeah, and we all need to engage with that, communicate the information, to educate. That's wonderful, and role models in our societies. Sian, I move to you. How can we tackle this threat together?
Thanks, Catherine. I think, yes, this point about the trusted authority, whoever that might be. I mean, I think that there's clearly work to be done at a very macro scale, but ultimately, if we want to shift it, we have to do work at a micro scale as well, and it's a sort of one-on-one intervention. The problem is it takes a lot of time. I mean, healthcare professionals have reported to me it can take half an hour maybe for an individual to be convinced to have the COVID vaccination. I mean, that's, it's a big pressure in the system. But if you can get that one person who's really hesitant to have it, then the knock-on effect could be great in that local community. And I think COVID's been particularly difficult because it all happens so rapidly. It's quite understandable that people are going to be needing to have faith, and that's quite difficult when there's so many messages out there which it's difficult to trust. So I think that building trust and recognizing that some of it needs to be at this one-on-one level is really important. And I do think that one of the factors of building trust is making sure that the healthcare professional themselves are really committed to the message. And with some vaccines, that isn't always the case. So that to me, I know I've said it before, but if I can just share this this slide. So this was work we did. It's about flu vaccination. You can see it's not new data. It was looking at healthcare worker vaccinations for flu from 2011 to 2015. And you can see the proportion of healthcare workers that were vaccinated. And doctors tended to, support staff were the highest, doctors weren't bad, nurses were the lowest. So if we can't convince the healthcare workforce of the value of a vaccination, that really is going to be problematic. And so certainly that's something that's been scaled up more in the UK, is trying to understand what their reticence is and what worries them, because we've just got to recognise that the worries are genuine and then try and understand and help.
Sian, I take from that building confidence with also everybody being a role model in this situation, no matter what role you hold. Yeah. But also some interventions may take time. That doesn't mean they're not worth investing in. Let's do the quick things quickly and then take longer for the slower things. Thanks so much, Sian. Jane, I started the panel with comments from you, so I'm going to ask you for the final comments on this. How do we tackle this threat together? And then we'll move on.
Thanks, Catherine. It's been a very rich conversation. Just a couple of high-level comments to begin with. We need to recognise that vaccines and vaccination have been politicised across the last 2 years, and that will continue. It's not going to go away. Mariano said something very profound, and that is that this is not a short-term strategy. This is long-term. And for IFA and for, Active Citizenship Network and FIP, and, we actually need to decide that this is going to be a long-term strategy and buy into it, because we can't have organisations coming in and out, because people lose trust in us if we keep flip-flopping. I think also, Gary and Sian also said it, Go to where the person is with their questioning. Don't assume that you can just say, just get the vaccine. Go to them. Also, solutions are very situational specific, and that not only the location, but it's also the population group that you're working with. That it's older people, younger people, people with diabetes, people with cancer. It's about going to them and their particular, and that's why targeted messages. My final comment is around vaccine hesitancy. I think there's general comment, well, she or he is vaccine hesitant, they're vaccine hesitant. Perhaps they're not. Perhaps that they just can't get to the pharmacy to get their vaccines. So I think we need to unpack that a little and just not assume as professionals that they're vaccine hesitant. So high level, deal with the misinformation. The politicisation is going to stay with us. Long-term strategy is the only strategy, and bringing unlike together. And by that I mean we actually have to have different disciplines and sectors at the table to develop a common agenda. Thank you.
Superb, Jane, as ever. And I think having this panel today brings some different perspectives to the table, which we can build on. It's all about trust, isn't it, colleagues? And it's all about understanding now COVID will become part of our immunisation agenda going forward, and we'll have hesitancy, we'll have beliefs, we'll have concerns, we'll have worries. We just have to now address them and stop pitching people against each other. I think that's a big message for me today. Now, colleagues, I hope to be able to have a little bit more time with the panel, maybe towards the end as we move to closing. I'd just like to move us to the second part of the meeting today. And for that, I'd like the slide deck back, if I may. And for that, we'd like to move to our launches. And I'm really delighted to welcome my colleague, Gonzalo Sousa Pinto, who is the FIP lead for Practice Development and Transformation, who will walk us through some of the important announcements that we have to make with you today. So, over to you.
Thank you so much, Catherine, and congratulations to the whole panel for such a lively and rich conversation. And in line with a lot of what has been said and commented by the various panel members today, we FIP have highlighted the priority or placed high priority on the issue of vaccine confidence and addressing vaccine hesitancy and complacency. So there's a number of resources in this area that we are launching today or sharing with you today. The first one being this draft 0. This is not a launch of a document, of a final document, but rather placing a draft on the table as a starting point for a conversation. And this is a commitment to leverage pharmacists to building vaccine confidence and addressing vaccine hesitancy and complacency. So as has been highlighted by Catherine and the panel members, vaccine hesitancy is a major global threat to global health, and this is stated by WHO in 2019. WHO listed vaccine hesitancy as one of the top 10 threats to global health, and this is related to barriers such as misinformation or disinformation and distrust in vaccines, but that can really compromise not only the health of individuals, but also public health as a whole. And with this in mind, pharmacists, we have realized that by being placed at the heart of communities, being highly accessible and having the expertise in medicines in general and vaccines in particular, and being trusted by populations and having these frequent interactions with the community and with individuals, the community they know and they serve. This provides us with the opportunities for meaningful conversations to tackle concerns, to tackle doubts, to tackle hesitancy that people may have about vaccines. And this can lead to increasing vaccination coverage rates and to improving the protection of individuals and communities. And that's the context for why FIP is launching, well, this conversation about a possible commitment in the area of vaccine hesitancy. So what FIP is putting on the table as our draft commitment is that we commit to support this important role by pharmacists, and we advocate for a widespread utilization of pharmacists to overcome vaccine hesitancy, complacency, misinformation, and disinformation around the world. And the second point that we commit to is to join forces with our colleagues in other healthcare professional organizations and other civil society organizations to raise awareness about this major threat to global health and to advocate actions to minimize its impact on vaccination coverage and on individual and community level immunity against vaccine preventable diseases. So this is the document, the very draft zero that we put on the table for the consideration of our partner organizations. And we invite them to consider this as a collaborative effort. We invite them to either support this FIP commitment and this role by pharmacists at global level, but also we'll be delighted to work with them and with other organizations to co-develop a collaborative commitment. Another document that we would, and this is a formal launch of a new resource that is being shared with you today and with the community of pharmacists around the world, is a toolkit for pharmacists on how to build vaccine confidence and better communicate vaccine value. This was also supported by an unrestricted grant from Sanofi Pasteur, to which we are deeply thankful. So this publication, what it does, it starts by identifying and understanding the various types of reasons and motives that people might have for being concerned about vaccines and having a defensive or a hesitant position in relation to vaccination. We then move on to two types of approaches that pharmacists can be involved in to address these vaccine hesitancy reasons or motives. One of them is through direct and individual interactions with individuals and by developing effective strategies for communicating vaccine value and supporting people in changing their attitude towards vaccine, which may lead to a change in actions or to an action of actually getting vaccinated. And the other one is a more mass communication strategy, which is the involvement of pharmacists in pharmacy-led campaigns to raise awareness about the value of vaccines. So this document provides strategies and guidance at these two great levels, let's say, and then has a final section that provides information for pharmacists on the various types of vaccines that are most commonly administered at pharmacies, but also more widely so that pharmacists can really know how to adapt their advice that is based on evidence, but also they have a summary there of information about different types of vaccines. And this all leads to supporting pharmacy practice development in vaccine hesitancy and complacency. So this toolkit includes, for example, in terms of communicating for change, it includes conversation guides with 5 examples, including different types of concerns, different types of patient profiles, and different types of vaccines that maybe these patient profiles would be eligible for or would benefit from, for example. So these conversation examples can support pharmacists in establishing similar or adapted conversations with patients and community members in their own pharmacies. We then have a few examples from campaigns, pharmacy-led campaigns from around the world. And at the end, we include this information on 8 different vaccine types, and I'll come to that in a moment. So we know that vaccine hesitancy exists on a spectrum of trust on vaccines. Most people would accept generally all vaccines and trust vaccines, and few patients or few community members would actually refuse all vaccines, very few. But in between these two extremes, many people accept some vaccines, but not all of them, or they may have concerns about vaccinating their children or their older parents, for example. So we need to understand that these concerns exist on a spectrum, and they may be related to safety concerns about the components of vaccines, about the efficacy of vaccines. They may also have moral or philosophical concerns about vaccines, or they may simply require more information to make their decisions. So, and within each of these 4 groups, we go into and identify different specific concerns and what is the evidence that can be used to address that specific concern and what is the advice that pharmacists can give. In terms of individual interactions, by identifying those specific concerns and different motives that people may have, and which in altogether shape what people think and feel about vaccines and what they know about vaccines, but also we understand that the dispositions that people may adopt are part of a social process of influences and peer pressure, for example, and this all shapes their motivation. So we need to understand the different levels of literacy, the levels of expectations and motivations, and we can provide adapted information and adopt effective communication strategies that can lead to change in behaviors with relation to vaccination. So this is what this toolkit addresses and provides tools for. And some examples, for example, of campaigns, we have examples from Costa Rica that are using WhatsApp groups and social media to share snippets or bits of information that can be shared more widely, but can also bring people to the pharmacy for longer conversations about this. Also examples from Portugal about the flu vaccination campaign and the campaign led by our colleagues in the American Pharmacists Association that is called the Vaccine Confident campaign that addresses specific concerns as well. So this is also a very valuable resource that they have on a dedicated website, vaccineconfident.pharmacist.com. Finally, the final section on vaccine information for pharmacists includes the different types of vaccines that there are on the market, what target populations they are for in general terms. Of course, this varies per country. What are the potential side effects and precautions? What observations that pharmacists should consider, and advice that they may give to the public to the various vaccine types, including influenza, COVID-19, but also shingles, pneumococcal, meningococcal, HPV, hepatitis, and Tdap, for example. So that's we invite you to visit the FIP website to download this new resource. And you see these 2 different URLs here, and the reason for that is that we have included this resource on our usual library that you are familiar with, but also we have a new microsite that is dedicated to prevention, and that we are launching today. So that's also available, and that's the reason for why this resource can be found in the 2 URLs. So in terms of this microsite, this is what it looks like, the home page, let's say. And as you can see, it has 3 sections on, well, it starts with an introduction, and then has 3 sections on vaccination, vector-borne diseases, and self-care. These 3 main divisions or pillars of areas of intervention where pharmacists can make a difference. So this is the structure of this microsite. Within each of these areas, vaccination, vector-borne diseases, and self-care, you have an introduction, but also you have a series of publications that and resources produced by FIP to support pharmacy practice. You have all the events that we have organized in each of these areas, and you have a description of our partnerships in each of these areas. And in the vaccination tab, you finally have also the link to the transforming vaccination program that we started last year, and we have a new one we're currently running this year as well. So you have the details of that program there as well. So this is the site, the website, and I would like to give you a very brief guided tour. And so I think I need to stop sharing and briefly share this one. So this is what the website looks like. As you can see, it establishes the links to the FIP Development Goal 16 on communicable diseases, which is the one that is most directly related to this one, and explains the various elements of the FIP Development Goal 16 on workforce, practice, and science. and the 3 dimensions that I mentioned here, that I mentioned before: vaccination, vector-borne diseases, and self-care. Under vaccination, you have the various, like a timeline of FIP's work and resources in vaccination, but also our publications that you can see here with a new toolkit already here, but also policy documents and advocacy tools, professional resources, survey data, statements at the WHO, World Health Assemblies or executive board meetings. So there's a number of resources here. And the same goes for vector-borne diseases, where you have publications, events, and partnerships. Under vaccinations, let me just highlight under the partnerships, we have the Immunization for All Ages initiative that IFA and ILC and other organizations are part of, COMO and the United Nations Shotted Life initiative or campaign. And this is an initiative that is supported by Pfizer. And so the resources made available by this coalition are also available here. So this website is the resource center and the resource hub for all the resources produced by FIP in these various areas, and the same for self-care, publications, events, and partnerships. So all put together here for you to use. And that's it from my side. So thank you very much, and back to you, Catherine, for some final remarks.
Thanks so much, Gonzo. I think that's just a great way to showcase almost like a collation of things that have been under development for quite some time in an accessible way. Now, if I may, I'm going to ask my panelists to put themselves on camera as I prepare to close the event. I just want to sum up a couple of the things that we've said. There are some big societal things we all need to do, and we all need to be aware that we're going to live with COVID alongside other emerging pandemics. Please God, not for a while yet, but we need to learn from this one. There's something about us not pitting ourselves against anyone else in the agenda, whether it's members of the public, whether it's age groups, disease states, or other professions. There's something about using the accessibility of the pharmacy to great intent, but not overburdening them. Jane, you're quite right. Just because you can doesn't mean there's enough hours in the day for you to do it well. And maybe to have this, Gary, you mentioned about if there's 6 community pharmacies in a town, maybe some could be doing some things and others could be doing other things. I know that doesn't sound great from a business perspective, but actually maybe it sounds really great if we think about the workforce we have and the services that are needed. The final piece I just wanted to mention was a bit of an outreaching of a hand. Now, you've seen the FIP commitment to addressing vaccine hesitancy. We'd love to leave with our colleagues on the panel, with the diverse range of civil societies that they represent, an opportunity to support that, or maybe for us to draft our own commitment, taking all the perspectives that we've heard today. And I think by doing that, we can shake some trees. We can together provide a new coalition of different types of organisations that may help others to get on board as well. It might be the start of something very special for 2022. We also know we're not going to be out of this for any time soon. And what we learned we're doing a piece of work where what we've learned each 100 days since January the 30th will help inform what we could do better next time when a pandemic hits. So we've got a couple of minutes. I noticed, Jane, immediately you put your support up. Let's follow up afterwards, but it'd be great to have the other colleagues on the line from your various different civil societies, your thoughts on that and how we might collaborate, coalesce, and then cooperate to shared agendas. Final words, colleagues?
Just to say, Catherine, the IFA steps forward unequivocally to work with FIP. You share unconditionally, you reciprocate, and clearly appreciate overlapping is okay, core business is good, and I'm delighted that we can work with FIP, but also, Mariana Votta, a short-term relationship that's going to go on for years to come. So I look forward to, what we can do together going forward. Sian and Irina, thank you. and Gary.
Wonderful. Thanks, Jane. I'm very happy in the final minute to hear a word or two from each of the other colleagues. Mariano?
Thanks. First of all, I want to thank the International Pharmaceutical Federation for not only for this initiative, but for the political initiative to try to build an alliance and to support the civil society, and in general to identify the civil society organization as a stakeholder. So my last message is to be more active on vaccination. That is in line with the name of my organization. Please let me remember that yesterday in Italy it was decided that pharmacists are authorized to deliver flu vaccine in this flu vaccination campaign, of course, according to the procedures, the rules, etc. But this is a new that was established yesterday, and we are in the process to increase the commitment of the pharmacist in my context, my country.
That's wonderful news, Mariano. Great to hear. Gary, final word?
Nothing much to add. We're happy to continue and expand our collaboration, and thanks a lot for including us today.
Wonderful to have you. Thanks a million. Sian?
Thanks, Catherine. Well, yes, our board of directors wants to partner with organisations that we can trust and have fun with, and I think that's something that we can do with FIP. I think our goal is to really get a greater investment in primary care in general, because we think that's the way to achieve universal health coverage. And we think pharmacists are part of the team, and it's a really important part. And the prevention agenda comes with that.
That's wonderful. And we love the overlap between the prevention and the NCD that is respiratory disease. It's really important. But yes, if we can have a bit of fun along the way, why not? Thank you, Sian. And Irina, final word to you.
Thank you very much. First of all, I want to thank for your job, for your prepare this agenda, for prepare this a lot of document and site which we can use this. And I see I will try to promote any level, any country to these documents, and how we can improve this situation. But in same times, we must find motivation for implement this in real life, motivation for pharmacists for implementing this great agenda, and let's work together. That's all. Thank you very much.
So Irina, I take from you, it's not so much blah, blah. We have to do some concrete stuff as well. So I think we're all on board for that. This is not a time for just warm words. This is a time for cold, hard action as well. Colleagues, it's been an absolute pleasure. The time has whizzed by, but I thank you all so much. I'm 2 minutes over, but I felt I needed to just get all of your final reflections before we finished. Thanks so much for your time. Thank you for the colleagues who have stayed with us right to the end. And we look forward to colleagues downloading this after the event. It's a great opportunity for us to join forces, and we know together we're stronger. No one can do this on their own. So thank you, colleagues, for your words, your actions, and your long-term collaborations. Thanks, team, as well, and we'll see you all very soon.
Thank you so much.
Bye.